Today, we're going to talk about the inflammatory cascade response. In arthritis, it involves a chronic inflammatory immune response in which the body's immune system attacks its own joint tissue. This is also known as an autoimmune response. In joint inflammation, the inflammatory response is triggered by damage or irritation to the joint tissues. Here's how the different cells and molecules are involved in the inflammatory cascade response. Cytokines are released, and they play a crucial role in the inflammatory cascade by acting as chemical messengers that signal immune cells such as T cells, B cells, and macrophages to carry out their specific roles in the immune response. Mast cells are initiated by antigens releasing histamines, heparin, and protein enzymes for tissue remodeling and repair. Histamines induce vasodilation, increased vascular permeability, and recruitment of eosinophils, basophils, and mast cells to the site of inflammation to increase blood flow and promote the immune response. Prostaglandins and leukotrienes are also signaled that further amplify the inflammatory response. Macrophages are typically activated by signals released by cytokines during inflammation. Macrophages themselves release cytokines, chemokines, phagocytose cellular debris, and activate osteoclasts that cause inflammation and damage to bones and cartilage. T helper cells are activated by signals from antigen-presenting cells such as dendritic cells and macrophages, which present antigens to the T cell receptors. T cells identify harmful substances shown by macrophages and send signals to activate other immune cells like B cells and killer T cells. T helper cells also activate osteoclasts. B cells are produced in response to the activation of antigen-presenting cells. B cells bind to inflamed tissue, leading to the production of autoantibodies that attack healthy tissue, exacerbating inflammation and damage. Killer T cells may attack and destroy cells in the joint tissue that have become abnormal and present fragments of self-antigens, triggering an autoimmune response. Eosinophilic granulocytes are a type of white blood cell that accumulates in the tissue during certain types of inflammation. Eosinophilic granulocytes can harm tissue by releasing toxic substances, and white killer T cells may not directly destroy or kill them. They can contribute to the inflammatory response that attracts these cells to the site of damage. Cyclooxygenase enzyme is produced by the eosinophils, is involved in the production of prostaglandins, which cause pain and inflammation. It also is responsible for thromboxane, which helps blood to clot in times of injury. Prostaglandins are chemicals that play a role in a wide range of bodily functions, including regulating fever, promoting blood clotting, muscle contraction, and hormone regulation. Prostaglandins can promote inflammation and pain in arthritis by sensitizing pain receptors, dilating blood vessels, and recruiting immune cells to the affected area. Platelet growth factor is released by platelets in response to tissue injury or inflammation. Platelet growth factor stimulates the proliferation and differentiation of chondrocytes and osteoblasts, which are involved in the repair and regeneration of damaged tissue. Tumor necrosis factor is released by macrophages. It can cause destruction of tissues by promoting the production of inflammatory cytokines, activating immune cells like T cells and macrophages, and inducing the expression of enzymes that break down tissues. Nitric oxide is typically produced in immune cell macrophages and neutrophils. Nitric oxide helps to kill invading pathogens by damaging their DNA and proteins, and regulates blood flow and inflammation by dilating blood vessels and increasing blood flow to the affected area. This helps to recruit immune cells and deliver oxygen and nutrients for tissue repair. Interleukins are typically produced by immune cells such as T cells, B cells, and macrophages. Interleukins communicate with T cells and B cells and macrophages to coordinate their response against pathogens and regulate inflammation levels. T helper and B cells produce cytokines that trigger the production of antibodies like IgA, IgE, and IgG to fight against infection, pathogens, or inflammations. Eventually, the immune response subsides, but in cases of chronic inflammation, the inflammatory response may persist if imbalance is not addressed. This then causes further damage to the tissue. Thanks so much for joining.